Hi, Dr. Hellshine here. Today we're going to have a discussion about what's happening in medicine and things that you can do to change the impact on your medical practice. What's happening in medicine nowadays, if you're like most doctors I know, over the last 5 to 7 years, your income just keeps creeping down, 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 yet your workload keeps climbing up, up, up. Some doctors are turning to concierge medicine. This is not what our discussion today is about, but the concierge concept will creep into our discussion, so I wanted to bring that up in the very beginning. What I would like to talk to you about is the state of healthcare in America. If you look at healthcare in general, there is one big pink elephant that sits in the corner, and that elephant is cardiovascular disease. Every 33 seconds, somebody dies from a heart attack, 2,600 people per day, 1 million people per year, half of them being women. So what I'd like to talk to you about is how we change the course of cardiovascular disease in this country. And the way is through you, the primary care doctor, the internal medicine doctor, the family practice doctor, the OB-gynecologist, the podiatrist, the naturopath, all these different disciplines, preventive cardiology and integrative medicine, along with concierge doctors. I have an opportunity for you to really make a difference in our society. The way we're going to make a difference is by changing the paradigm of how cardiology is handled. Now, I'm not talking about cardiology in the form of stenting, balloons, bypass surgery, nuclear medical scans. I'm not talking about angiograms, MR angiography or CT angiography. What I'm talking about is the fact that for somebody to get to the point where they need those services, they've had to go for 15 years of doing the wrong thing. And so what I want to speak to you about is early warning indicators for cardiovascular disease. How do we measure them? And then what do we do to treat them? And you are going to get the benefit of this by becoming a concierge medical doctor in the form of creating a cardiovascular center of excellence within your office. Now, the first thing you're probably thinking is, what is it going to cost you? Nothing. There will be no cost for us to work with you as a partner in cardiovascular excellence. So Level 1 Diagnostics is our company, and Level 1 Therapeutics is our other company. I'm the founder of both, and what we're going to do is we're going to bring our services in as a partnership with you. We will provide you the equipment, the technician, the screener, all the paperwork, and the insurance questionnaires to help us do a cardiovascular center of excellence in your office. And why should you do them? Because what we're doing right now in the field of cardiology in this country is not working. We are number 1 in healthcare spending. We're number 33 or thereabouts in healthcare delivery. The quality of our care is very poor. The cost of our care is very high. And you and I are going to work together to change that. And here's why. Last year, 1 million people in this country died from heart disease. The year before, 1 million people died from heart disease. It's not getting better. And what I'm going to suggest to you is that there is a way to make it better. So let's talk about that. There are early risk factors for cardiovascular disease, and I'm going to roll out to you what they are. The first one is heart rate variability. In the Framingham study, 2 things were said about HRV. The first thing that was said is it's the number 1 risk factor for sudden cardiac death. Sudden cardiac death. Tim Russert died of that. Had great medical care, that newscaster, went to Washington to one of the hospitals, had a full workup, was put on statin, was put on baby aspirin, and somebody walked up behind him, yelled boo, and his heart went into an arrhythmia and he died. That's called sudden cardiac death. And the first sign of sudden cardiac death is death. And that's one heck of a wake-up call. So we measure for HRV imbalance. for HRV regimentation, where the R-to-R interval is fixed each time. And we're going to then provide a program for a patient to normalize their heart rate variability, to make it healthier. The second thing the Framingham said is that in all patients in the Framingham, the one common denominator was that they had a healthy heart rate variability. So HRV is one of the first tests we'll do. The second test we're going to do is looking at the arterial elasticity. And we're going to wind up doing this in two different ways. The first way we're going to do it is by measuring the pulse wave velocity. So when the heart contracts, it pushes the blood out into the large artery, then the small, then the peripheral arteries. In front of that blood is what's called a pressure wave. It's air, it's being pushed forward. And by using plethysmography, we are able to measure the pulse wave velocity. So it's a time and dilation interval that we're looking at. And by measuring this, we're able to tell how stretchy is the rubber band. Is there elasticity to the artery in a physical way? So that's the second thing. And if there isn't, then we're going to help the patient do a stiffness regression program, which we've had great success with. The third thing we're going to do is called peripheral arterial tone. PAT is measuring a concept called reactive hyperemia. So we occlude a blood vessel on one side and we have a control arm on the other side, and after getting a baseline reading, we then occlude the blood using a tourniquet, and then we let it loose and the blood flows down. And if the lining of the artery, which is called the endothelial lining, secretes a signaling molecule called nitric oxide gas, then dilation will occur at the end of the artery. This concept is simple. It's the 1998 Nobel Prize for Medicine to 3 Americans who discovered that the endothelial lining secretes a signaling molecule NO, and it causes the arteries to dilate. From this chemistry, they developed Viagra. And we're using that same concept of getting dilation at the end of the finger to see whether or not reactive hyperemia is taking place. And if not, then we work on a program to help rebuild nitric oxide in the body. That's the third thing we're going to do. The fourth thing we're going to do is we're going to measure the heart sounds. And instead of listening to them, we're going to use a digital stethoscope to record them. And then we run them against a database of 50,000 murmurs. And we'll tell whether or not there's a class 1, class 3 murmur, whether an echo is needed, and if so, we'll order the echo. That's the fourth early warning indicator we're going to be looking at. The fifth early warning indicator we're looking at is body fat. There are different ways of measuring body fat. The most accurate is with infrared. So we have an infrared recorder where we look at body fat and we look at water content. We look at body fat in 3 different ways, with excess body fat being the most important. And if it's present, we have a wellness coaching program through Level 1 Therapeutics to help a person lose weight and also increase exercise. And we use a questionnaire called Staying on Track, which is a lifestyle inventory in which we measure different aspects of a person's health and how they may have shortcomings in different ways. And with that, we then wellness coach them into health. The next thing we're going to do in the cardiovascular risk assessment, looking at early warning indicators. Remember, that's the key. We don't want to wait until a patient is symptomatic. We want to catch them early. We want to catch them when they have these baseline indicators that we can still fix or help a person change. So what we're going to be looking at is an ultrasound of the carotid artery. And there are 2 ways to do an ultrasound of the carotid. One way is to do Doppler, and Doppler looks at blood flow and it looks at the color of blood flow. The problem with Doppler is that you can have a 65% blockage and still have a normal Doppler. The second way to look at a carotid is by measuring the intima media thickness. That's the lining on the inside of the artery, and we're going to measure how thick it is. So just like some people can build up a callus on their hands from hard work, the carotid can build up a callus on its lining from hard work. What kind of hard work are you talking about, Steve? You must be asking yourself. The answer is shear force. Shear force. This is when the blood pressure is elevated and it gets pushed into the carotid and it bounces off the wall and starts to tear it apart. What we do in our program that's different than what anybody else is doing is, rather than measuring the carotid Doppler using a JPEG or 6-second loop, we film the entire carotid using a very special program that's in our lineup called DEVO. And DEVO is the only HIPAA-compliant, FDA-cleared video capture system. And we use it to record the whole carotid on both sides. And then instead of having it looked at as a JPEG, we send it off to our analytics lab where it's looked at incomplete. We look from the top to the bottom of the carotid, and we're able to measure the percent stenosis. We're able to measure the plaque formation. Is it soft? Is it hard? And we're able to measure whether or not that plaque has soft plaque that could break off. So with this in mind, we also measure the IMT thickness to see whether or not this callus is growing. IMT is a wonderful predictor of what's going to happen to the percent of stenosis 15 years down the road. And so we also measure the Doppler on top of this, so we have a very comprehensive evaluation of what's happening in the carotid. While we have the ultrasound out, we also measure the abdominal aorta, which is the largest artery in the body. And we're not only measuring it for an abdominal aortic aneurysm, we're also looking at it for whether or not it has any plaque in it. Because if we have plaque in the carotid, plaque in the abdominal aorta, arterial stiffness on the pulse wave velocity, and then endothelial dysfunction on arterial tone, we know that this person is going to be a candidate for bypass surgery or stenting in a few years. It's really important then to get them motivated on a plaque regression program, to increase nitric oxide, to increase exercise, to increase water consumption. We know the right things to do, and we have a wellness program that we work with the doctor's office for. Now, as I said, what am I selling you? Nothing. We want to partner with you to come into your office and set this program up. It's turnkey. We will provide the technician. We will provide the equipment. We'll provide the intellectual property. We'll teach you how to do the report of findings. We'll build a pharmacy in your office so that any supplements or items that help reduce the risk for cardiovascular disease, like a grip strength exercise program called Zona Plus, like stress eraser or the heart math or the brain paint for biofeedback to help decrease any mental distress that's occurring with the patient. These are the types of things that will help provide. You provide us the space, you help us with the patients, and you provide us a billing service. If you can't do the billing, we can help you with the billing as well. So as I say, this is a turnkey operation. There's really nothing at all to lose. We will help you build a cardiovascular center of excellence for your office. You'll be very proud that you chose to increase your income through this means rather than either trying to see one patient a minute to increase income, or to do Botox, or to do any kind of cosmetics. Let's fix what's really wrong in our healthcare system: cardiovascular disease. The cardiovascular program also includes pulmonary, sleep disorders, neurology, obesity, and metabolic syndrome as part of the wheelhouse that we work in. So I hope you'll join Level 1 Diagnostics. I hope this is of interest to you. And if so, give us a call at 410-707-5667. Level1diagnostics.com. Thank you very much for your time.